The bowel is part of the digestive system. So when we eat our food, it is partially digested by the stomach and then goes to the bowel. Now when we talk about the bowel, we talk about the colon and the rectum, which is the large bowel. And the large bowel absorbs water and processes the waste that we know as poo, which comes out when we go to the toilet. Well, the main risk factor for bowel cancer is age. So the older you are, the more likely you are to develop bowel cancer. But there are other risk factors as well, such as family history. So if you have someone in the family who has had bowel cancer, and especially if they're quite young, then that could mean that you're more at risk of bowel cancer. Other risk factors include inflammatory bowel disease, so that's Crohn's disease and colitis. People with those conditions could be more at risk of bowel cancer. And also diet. So people who have a diet that is very, very high in red meat and processed meat, they could also be at risk of bowel cancer. Most bowel cancers actually start from polyps, and polyps are small growths within the lining of the bowel which are very common and mostly harmless, but sometimes they can grow larger and are therefore at risk of becoming cancerous. Now we don't know really why some polyps become cancerous, but it could be triggered by a person's genes, or it could be because they smoke. We know that smokers are more likely to develop polyps, and polyps are where most bowel cancers start from. Bowel cancer affects men and women. Of the people who are diagnosed with bowel cancer, about 55% are men and about 45% are women. Most people who develop bowel cancer are over the age of 50, so it is very much an age-related disease. It's the third most common cancer in this country, and it's the second biggest cancer killer. But the good news is that if it's diagnosed at the earliest stages, bowel cancer is highly treatable. The symptoms to be aware of are bleeding from the bottom or blood in your poo, a change in bowel habit for 3 weeks or more, and by change I mean a significant change, so going to the toilet much more often than you would normally. If someone is extremely tired for no obvious reason, that could be a symptom, and weight loss and lumps or pains in the tummy. These are all symptoms that should be reported to a GP. Most of the time they will not turn out to be bowel cancer, but if anyone is experiencing those symptoms, they must get them checked out by a doctor. The bowel cancer screening programme is for people between the age of 60 and 69 in England. In some areas, people up to the age of 74 will be screened. And what happens is, if you're within that age group, you will receive a kit through the post, and this kit is for taking your own poo sample. So you're provided with the kit and also with some sticks to take the sample. And what you should do over 3 separate occasions, so that's 3 separate bowel movements, is take a tiny sample with a stick and put it on the square on the test kit, and you do that twice on 3 separate occasions. What you do once you've completed that is you send it back in the envelope provided, and it goes to a bowel screening centre. And what they're actually looking for is blood in the poo that you can't see. They will test it, and if they find blood in the poo, so if they find no samples at all of blood, the test is normal and you'll receive another one in 2 years. If you have 1 to 4 samples of blood, you'll be sent another test kit, and if you receive 5 to 6 positive samples, then you'll be invited to speak to a specialist about further testing. And further testing usually means a colonoscopy, which is where they insert a tube into the back passage and they can see what is causing the bleeding. And sometimes it's polyps and sometimes it's cancer. In most instances it's neither of those. Well, the important thing to remember is that early diagnosis saves lives. So you must know the symptoms and you must get screened if you're within that age group. But to reduce the risk of bowel cancer developing, you should eat more fruit and vegetables and more fibre and reduce your meat intake and exercise, because these do reduce the risk of bowel cancer developing. People are often concerned about constipation, and that's usually down to a lack of fibre in the diet. So what we would normally suggest to someone is to increase the amount of fruit and vegetables and whole grains in your diet, such as wholemeal bread or wholemeal pasta or whole grain cereal. But for people who can't tolerate high fibre diets, well, they could increase the amount of water that they drink or exercise more, because this also helps the passage of waste through the bowel. We also get asked a lot about irritable bowel syndrome. Now, this is not connected with bowel cancer in any way, it is not a risk factor, but people who have symptoms of IBS, such as bloating or pain or a change in bowel habit, should always go to the doctor on a frequent basis to check that that is what is causing their symptoms. We're often asked about piles. Piles can bleed. Hemorrhoids, they're often called. They can also bleed. So if anyone has piles or hemorrhoids, they should go back to the doctor to check that that's what's causing the bleeding. But there is no link between piles and bowel cancer. And we do often get asked about meat. So if someone doesn't want to reduce their intake of meat, well, they can increase the amount of fibre that they eat. So they could increase beans and pulses, which are very high in fibre and also protein, so are a good meat substitute, as well as fruit and whole grains and vegetables. As I said, fibre does help a passage of waste through the bowel. And water as well. It's very important that if you increase the amount of fibre in your diet, that you increase the amount of water.